Welcome everyone to the Network for Public Health Law webinar, A Healthy Union, How States and Regions Can Lead on Environmental Health and Climate Change. I'm Kayleen Clarich, Associate Director of Communications at the network. A couple of housekeeping items before we get started. The webinar is being recorded and you will receive an email when the recording and the slides are posted to the network website. Feel free to use the Q&A function throughout the webinar if you have questions, and we'll try to get to as many of your questions as possible. And with that, I would like to introduce today's moderator, Betsy Lawton, Deputy Director of the network's Climate and Health Team. Betsy, I'll turn it over to you.
Thanks, Kayleen. If you would mind advancing the slides. For those of you that aren't familiar with the Network for Public Health Law has a mission to advance health equity and improve health outcomes by providing guidance on the effective use of laws and policies. And we work with a wide variety of stakeholders, everyone from local policymakers to public health officials, attorneys, and community-based organizations. And we provide technical assistance to a lot of people that we work with, which includes research and analysis of laws that are being used or implemented in other spaces, strategic consultation and guidance, and knowledge building and training. Can you advance this slide? Okay, so I will introduce our fabulous speakers today. First, we will hear from Jill Krieger. She is the director of the network's Climate and Health Team, and focuses on innovative legal and policy strategies to mitigate the disparate health impacts of climate change, to increase community resilience to climate change and natural disasters, and to reverse the impacts of inequitable laws and policies. Jill leads a team to work on topics such as extreme heat, flooding, climate migration and displacement, air quality, mental health, and community-engaged decision-making. Today, we'll also hear from Susan Kaplan, who is an environmental health lawyer, professor, and writer. She has held policy positions in federal and state government, served as assistant director of an energy policy group at Harvard University's Kennedy School, and taught environmental health policy in the public health programs at the University of Illinois, Chicago, and Northwestern University. Her writing has appeared in the Washington Post, the Boston Globe, the Christian Science Monitor, and other outlets. And her book, which we will be discussing in depth today, was recently published by Island Press and is titled A Healthy Union, How States Can Lead on Environmental Health. And just want to give a brief outline of how the webinar will lay out today. So first we'll hear from Jill on a brief summary of what's happening on the federal level, specifically federal rollbacks in the context of environmental health and climate change. And then Susan will speak to us about some of the topics in her book and how states are taking the lead, and using examples from the California air monitoring laws and health and all policy laws in Tennessee and Colorado. Then we're hoping to have like a 10-minute discussion session so people can put their questions in the Q&A, and we will start that discussion midway through the webinar and hopefully get to some of those questions. Then we will pick up the discussion again, and Susan will talk about regional efforts, such as the Regional Greenhouse Gas Initiative and how and opportunities for advocating for environmental health policies. Then we'll follow that up with another Q&A. So there'll be plenty of time to ask questions. So please be sure to get those in the Q&A so we can have our experts answer them. Thank you. Want to advance?
Okay. Thank you, Kayleen and Betsy. And I'll just, as Betsy said, provide a brief overview of what's been happening at the federal level, because that sets, I think, some of the context for the need for state, regional, and tribal action to address climate change. Next slide, please. So the new administration's approach to climate change was telegraphed pretty clearly on the first day of the new administration in a series of executive orders related to climate change, energy, the environment, environmental justice, and the like. We published a resource on executive orders that were issued in the first 100 days that related to these topics. And what we found were some of the themes were an intention of the administration, including directions to cabinet secretaries to take steps to increase production and distribution of fossil fuels, and essentially to end environmental justice efforts. These were included in executive orders about diversity, equity, and inclusion, but included directions to close environmental justice offices at agencies like HHS and EPA. Additionally, the executive orders indicated an intent to assess the federal role in emergency preparedness and pretty clearly telegraphed an intention to basically devolve much of the what has previously been the federal role down to state, local, and tribal governments. There was a huge emphasis on repealing and rescinding regulations related to the environment and climate change, as well as previous executive orders from previous administrations, directions to reduce funding and staffing across the federal government and across federal governmental programs. Many of those are involved in ongoing litigation. And we also saw a series of executive orders addressed toward increased production of other natural resources in addition to oil and natural gas, things like timber, coal, bringing back beautiful, clean coal, and limiting the protections of public lands to extract resources from. Next slide, please. So with all of that context of the federal administration's intent and goals as articulated in the first 100 days, one of the things that has happened, or more precisely not happened, is progress toward a sixth national climate assessment. The National Climate Assessment is an authoritative report with many, many chapters with in-depth analysis of various factors related to climate change and the environment, intended to inform decision makers, including health departments and the public, about climate risks. This report has been required by federal law since the Global Change Research Act of 1990. The fifth National Climate Assessment was released in 2025. These are such extensive undertakings that they take several years to produce. But in 2025, the authors for the sixth National Climate Assessment were dismissed, including volunteer authors, were dismissed from their efforts, and it's not entirely clear what, if anything, is happening in terms of producing a next National Climate Assessment. Next slide, please. Folks are probably well aware of the One Big Beautiful Bill Act that passed this summer, and it had, of course, provisions with implications for the whole of government, but focusing on provisions related to climate and the environment, I'll just pull out three. It terminated financial incentives for renewable energy and energy efficiency, such as rooftop solar, heat pumps, and upgraded insulation. Ended the electric vehicle tax credit, and repealed statutory authority and clawed back unobligated funds for the Greenhouse Gas Reduction Fund, which included some green investment strategies, Solar for All program. The status of the funds which were previously obligated, which was the majority of those funds, is still in litigation. I will note, however, that one provision that was included in an early version of the One Big Beautiful Bill would have preempted state authority to regulate the environmental and health impacts of artificial intelligence data centers for 10 years. And that provision was, in fact, defeated. So just an important, I think, point to draw attention to. Next slide, please. The final thing that I'll note is the repeal, or the proposed repeal, of the endangerment finding. I noted that there were executive orders really concentrated on rescinding and repealing regulations. And so one of those was a 2009 finding by the EPA that six well-mixed greenhouse gases that are emitted by motor vehicles threaten public health and welfare. Now, that finding was produced after a 2007 Supreme Court opinion, Massachusetts v. EPA. And that finding, after guidance from the Supreme Court, that finding activated regulatory authority under the Clean Air Act. But now in 2025, the EPA has proposed rescinding the endangerment finding on two grounds. First, they conducted their own much less intensive assessment of climate change. It was by five basically hand-selected authors, produced in a few months, as opposed to the National Climate Assessment, which is produced by hundreds of authors over several years. In any case, one of the bases relied upon by EPA for proposing repeal of the endangerment finding is stating that the climate science is not very compelling. EPA also advanced the argument that the Clean Air Act actually does not provide authority to regulate greenhouse gases. This conclusion has been vigorously countered by many in the environmental and public health communities, including a report by the National Academies of Science. Sorry, I'm blanking out on what the E stands, Science, Engineering, and Medicine, perhaps, which found that the EPA's 2009 finding was accurate at the time, has stood the test of time, and is now reinforced by even stronger evidence. A final rule has recently, in January of 2026, was sent for review at the OMB, specifically the Office of Information and Regulatory Affairs. And it's unclear how long that final review process will take. And we anticipate that there will be litigation related to this endangerment finding as well. So these are some of the key developments over the last year. But our presenter today, Susan, you've been looking at sort of the ups and downs of environmental law over a much longer scale of time, and presciently have been looking at state strategies and regional strategies, which is an emerging strategy for public health as well. So I'll hand it over to you.
Thank you. So I guess I just want to preface my comments by saying just a little bit about why I decided to write this book. I have worked in environmental health policy for my entire career, but I think at a personal level, when I got involved with advocacy in my own community, in our local schools to try to reduce use of pesticides, use of hazardous disinfectants, to try to increase protections on high air pollution days, I was really faced with the shortcomings in federal protections on a personal level in a way that I hadn't really been on a professional level. So it really became personal, and I realized there are many gaps in federal protections. And so really, I started to look at the state level. I looked at what the protections were in the state I lived in, at other states, and I realized that there are a lot of disparities from state to state. And at the same time, there's a huge potential and power for states to fill in some of these gaps in environmental health protections that have been left at the federal level. So that's where my interest came from. And I guess just as a reminder, environmental health is the impact of the physical environment, air quality, water quality, soil quality, food quality, community design on human health. And I think within the field of public health, environmental health often tends to be not as well known. And I think there are some historical reasons for that, which are also one of the reasons I wrote this book. I started to learn about that history. I found it really interesting. Next slide, please. So the sort of diminishment of environmental health, I think, goes back to the very early 1900s with the 1910s, the 1920s. Teddy Roosevelt spearheaded the conservation movement. There was an emphasis on open space preservation, natural resources conservation. And the federal government started to take on a big role in this effort. For example, the National Park Service was established, the Bureau of Land Management. So we have this growing federal role in the area of natural resources conservation. At the same time, we have important public health efforts, but those were focused on improving sanitation in cities. And that was not as much of a broad-based movement. And it also it had less involvement on the federal level. So it was more diffuse. And so we start to see these two areas separate somewhat. Next slide, please. And then when moving up to the 1970s, we have establishment of the U.S. Environmental Protection Agency. We have passage of a whole raft of environmental laws, Clean Air Act, Clean Water Act, Occupational Safety and Health Act. And we didn't see, again, just as in earlier in the century, we didn't see quite the same broad-based movement in public health. So again, we see more separation. Next slide, please. And something that happened with that separation is that when the US EPA was established, programs at federal agencies that addressed public health areas like air quality and drinking water quality were moved to the EPA. And they were moved there from, I think, the agency was the Department of Health, Education, and Welfare and other agencies. And these public health programs were moved to EPA. The goal was consolidation in order to strengthen environmental protection as well as environmental health protection. Instead, what happened was that it reduced attention to the public health aspects of environmental issues. Then this pattern we see became replicated at the state level. So a lot of what you see at the state level right now is you have an environmental agency and it has specific regulatory duties. And it's focused on environmental protection, but it may not have public health expertise to understand how do environmental issues affect public health, affect environmental health. At the same time, you can have state public health agencies that do have that public health expertise. They have epidemiologists, they have toxicologists, they do surveillance. But those state public health agencies, as many of you know, have lost a lot of funding. They tend to have less regulatory authority than the environmental agencies. So again, we see environmental health being just diminished relative in terms of environmental health protections. And so this has been a continuing theme. And I guess some additional reasons for the reduction in federal environmental health protections. One is growing partisan divisions starting in the 1980s. So after the 1970s, there was this bipartisan support for environmental laws. And in the 1980s, we start to see this diverge. And so disagreement over the proper role of government, some people wanting the federal government to continue this work, others wanting it to step aside and let the more of the private sector handle these issues. And then industry influence has also contributed to some environmental health weaknesses, such as watering down of certain regulations. Next slide, please. So states started to move to the forefront, and California led the way. And so in many ways, this is a great example of federalism, and it's really what was meant to happen. So states can be laboratories of innovation, and California has been, and we want that to happen. Then there's a downside, which is when you have different states that are further along or less further along with environmental health protections, we see that inequities start to arise. So it starts to matter more which state you live in. And also, interestingly, with California, California is the only recipient of a waiver under the Clean Air Act that allows it to set its own motor vehicle emissions standards that go further than the federal standards. We start to see what a law professor at UCLA coined iterative federalism. So kind of a back and forth. The federal government's environmental health protections affect the states, especially California's. What California does affects the federal government, and sort of back and forth. And so that is also kind of an interesting aspect of the role of states in environmental protection, environmental health protections. And I would also just note that in the late 80s and early 90s, we start to see additional states step up. So California was first, and then we see the Massachusetts Toxics Use Reduction Act, very influential state toxics use reduction law enacted in 1989. In 1991, Texas passed a law requiring every school to develop policies and programs to reduce hazardous pesticide use. So those are 1989 and 1991. So we really start to see states step up around that period of time. And I also think it's notable that if you think about how long ago that was, that's a few decades ago, and both of those laws have been extensively analyzed. So from the perspective of thinking about what can states do, we have a lot of information. We have a lot of great models, and we have a lot of analysis showing how and why those state environmental health policies have succeeded, lessons learned, return on investment. And so there is a lot of information there about out there about state best practice policies. So next slide, please. We'll move on to one of those state best practice policies, and that is California, which has this very cutting edge local air monitoring law. And additional states are developing these laws and policies and programs as well. Next slide, please. So California's Community Air Protection Program, and this was enacted in 2017. It's known as AB 617. And it starts with a new approach to understanding pollution exposures. It starts with an understanding that not everybody is equally vulnerable to pollution and toxic chemical exposures. There are particularly vulnerable groups. And I'm not going to get into the reasons for that, and I'm guessing many of you are pretty aware of this, but pregnant women, children, environmental justice communities, those with pre-existing illness, and the elderly are groups that are particularly susceptible to health impacts of pollution. Next slide, please. So California developed a tool called Cal EnviroScreen, and they are now on the 4th iteration of this tool. And it is a new approach to understanding exposures called cumulative impacts. And this is very different than the traditional approach. So the traditional approach looks at one contaminant at a time. But of course, in our daily lives, when you're going out for a walk or a run or whatever it might be, we're all exposed to multiple kinds of pollution and toxic chemicals simultaneously. And additionally, we all have different factors that affect our susceptibility to the health impacts of those. And so California, with this tool, is trying to move to a more real world understanding of how this works. And so this graphic shows what they take into account, and there's a huge amount of data from all sorts of state agencies that goes into development of this tool. And ultimately, what it leads to is that it allows the state to use a relative ranking method to identify the communities in the state that are most heavily impacted by pollution, including the pollution they're exposed to, as well as population characteristics that increase the impacts of that pollution. And the state wants to direct more resources and enforcement in those directions. And so that's the goal. Next slide, please. So these are some of the main requirements of this law. And so I think there are two really, really unique aspects to this law. The first one is the requirement for local air monitoring. And so it's important to understand that the US EPA's air quality monitors are located far apart, and they're meant to measure air quality in a region, not in one very specific local place. And so the US EPA's air monitors purposely are not placed near a specific emitter. So what local air monitoring can do is both measure very local emissions. You know, where you live, you might have a different pollution exposure than someone who only lives a few blocks away. And something else that local air monitoring can do is identify emitters that regulators aren't even aware of. So this is really, really significant. And the second really unique aspect of this law is that it aims to treat community members as equal partners with state regulators. And of course, that is absolutely a new effort. And so, again, so very significant. And so the state uses that CALEN virus screen tool and identifies the most heavily pollution impacted communities. It chose a number of these communities to work with state regulators, to have meetings between community steering committees and state regulators, to identify the emitters of pollution, to do more local air quality monitoring, and then to develop emission reduction plans. And the idea, again, is that the community steering committees and the state staff are on an equal footing. Next slide, please. So this was a big law in a big state. And so, of course, it was incredibly complex. I think this was the most challenging chapter of my book to write because California is so huge and so complex, and just so many different layers. So it's a very, very innovative policy, but some community members didn't feel they were treated as equal partners. There was some concern about the state staff came in with ideas already developed about pollution reduction and asked the community members to respond to the state staff's ideas, and the community members wanted to have an equal role in coming up with the ideas for pollution reduction. There were concerns that some materials were not translated into Spanish, so some people dropped off of this of the steering committees. There was a concern about the lack of involvement of planning agencies. And so the state staff who were involved here were the air pollution regulators. But a lot of air pollution has to do with local planning and zoning decisions. Is a new school going to be built next to a polluting factory? Um, what do we do about a shipping port with diesel emissions? And we're building houses nearby. So these are zoning and planning decisions that often happen at a local level, but they were not involved per this law. At the same time, this was a huge success simply by being incredibly innovative, and it's still evolving. So it was follow-up law was passed in 2022. The original law was 2017. So it's still evolving, but overall, it represents a huge shift. So a couple of the people that I interviewed for this chapter, one of them called it a bold new approach. Um, the physician member of the California Air Resources Board referred to it in our interview as transformative. So these two innovations of extensive local air monitoring and extensive community involvement are new and innovative and transformative. The state published two blueprints. And so this is essentially, how is this program going to be implemented? They published the first one. They got a lot of community feedback. They published the second one, and you can see the cover right here on this slide. And for any other state that wants to do this sort of work, take a look at Blueprint 2.0. It's, states can learn so much from other states. And so that, I think is a real cause for optimism. Next slide, please. So some lessons learned for other states from California's program. So structure so that we have equality with community steering committees and state staff. In terms of how do we get this to actually work day to day, make sure that facilitation is really well done, really professionally done, because conflicts are inevitable and we don't want these efforts to devolve into sort of infighting. And so that's really important. And so Jonathan London from UC Davis, who's been the main academic who's analyzed this law, said, invest in process. And so I think that's a really important lesson learned. Again, involves zoning and planning agencies. And so that wasn't done initially, but there are efforts towards doing that now because of the understanding that land use decisions have a huge impact on air pollution. And then involve additional state agencies that impact air pollution. And so this goes to what we call health in all policies. So an approach that a range of different agencies that all impact that all impact environmental health, public health, environmental health, work together, even if they're not specifically a public health agency. And we're going to talk more about that in a few minutes, but it was one of the recommendations for strengthening this California law. One example came up with pesticides. Some pesticides are designated as toxic air contaminants, but they are primarily regulated by the state's pesticide agency, with the state's air quality agency having limited authority over them. So bringing the pesticide agency to the state could then provide further protection. So again, referring to a health in all policies approach. Okay, next slide, please. No, and so I've been happy to find that there are a number of efforts around local air monitoring programs around the country. So an example is New Hampshire. You can see here, New Hampshire allows purple air owners. Purple air are those small, inexpensive air quality monitors. They're anyone can purchase one if you'd like to. And they have a website where people post air quality readings, and it's an interesting website to look at. So New Hampshire allows purple air owners to register their monitors with the state, and then the state helps them with maintaining their monitors, and they're able to share their data with the state's network. In New Hampshire, a big concern is wood smoke, and that is PM 2.5, fine particulate matter, from burning wood for heat and also wildfire smoke. So New Hampshire has 6 regulatory air monitors. In other words, 6 air monitors that are set up around the state under the Clean Air Act. But New Hampshire says, however, this style of monitoring may not represent smaller neighborhood to neighborhood, that is hyperlocal, differences in PM 2.5 pollution. I also found something called the Appalachia Citizen Air Monitoring Project. The concern there is dust from mining operations and other fossil fuel infrastructure. It's a partnership of 16 community groups and 2 universities in Kentucky, Pennsylvania, Tennessee, Virginia, and West Virginia. It's federally funded. It doesn't seem to have involvement of state agencies, as far as I could tell when I was looking into it. The bad news is it appears that US EPA funds to support these programs have ended. In other bad news, Louisiana prohibited purple air sensors in local communities. So clearly we have some challenges here, but there's also much more awareness about the importance of local air quality monitoring. And, so I think this is a very interesting and timely area. And we can learn a lot from California. Next slide, please. Okay.
Susan,
Yeah.
may I interject just really quickly? We did have a question specifically about California law that I thought I'd just ask right before we step into the next topic,
Great.
if you don't mind.
Sure.
The question is, why did California need a waiver to set a more stringent law? I always thought that a more stringent law can be adopted and applied, but not a less stringent law. That's the question
Right.
from the audience.
Yeah,
So
right.
thank
That's
you for
right.
answering that.
Honestly, Jill might be able to answer this better than I can. I believe generally that's right. As a general principle, states can pass more protective laws than the federal government. We see this with something like OSHA laws, state regulations that go beyond federal regulations. My understanding is that the motor vehicle provisions of the Clean Air Act were different because automakers needed to have one national market because it was going to be too complicated for them to have to address emission laws, 10 different emission laws. I think that's correct. I don't know. Jill, do you have any insights?
Like you, Susan, I think that's correct. So rather than respond with respect to those specific provisions in the Clean Air Act, I will just say that the general rule, there's a concept called floor preemption and ceiling preemption. So the most common form of floor preemption is to say you must do at least this much at the state level, if it's the federal level setting the law in place, or at the state level saying to locals, you must do at least this much. But there is also a ceiling preemption where a law from a higher level of government might say, actually, you can't do anymore. This is the highest bar you can set. And that's frankly sometimes what industry might do is they might go to that higher level. They might go to the state to try and get ceiling preemption. They might go to the federal level, as Susan was saying, the automakers did, to try and get ceiling preemption. And one of their arguments can be consistency.
Yeah, thanks. That's a great question. Should I get back to my slide, Betsy?
Yeah, thanks for letting me ask that question because it was just so relevant to what you were talking
Completely
about.
relevant. Yes, thank you so much. Okay, so so now getting back to collaboration across agencies, typically referred to as health and all policies. Next slide, please. So the traditional siloed approach that you'll see is we have our public health agency, and then we have all these other agencies. And so the transportation department, for example, focuses on building roads and other infrastructure. Needless to say, it has an absolutely massive influence on environmental health. Whether it chooses to build roads near, a highway near sensitive populations, whether it the sorts of vehicles it chooses to purchase and how the sort of pollution they emit. So the transportation department has huge impacts on environmental health, even though it doesn't have environmental health in its name. So, and then this is the case for many agencies. So the question is, how can a health agency bring these other sister agencies into health discussions, especially when those other agencies may have no statutory responsibility regarding environmental health or necessarily an incentive to get involved? They're already busy, with their meeting their own requirements, and there may even be a disincentive. So how can we do that? We know from experience that different agencies working together, as with the transportation example, can create huge improvements in environmental health. And in fact, it's really kind of necessary for the transportation department to consider public health if our overall goal in this this example state, is to improve public health. Next slide, please. So Tennessee is typically looked to as the leader in this area, and its effort is called the Tennessee Livability Collaborative. And so there are now 24 state agencies that meet on a regular basis to get to know each other. And at each one, my understanding is that it used to be that lunch was always served. That's a little bit of an incentive. I think now it goes back and forth between that and online meetings. And at each one of the state agencies makes a presentation about what they do, and they get to know each other and figure out how they can work together so that they can all work towards better public health in the state. And this was initiated by the state's health department director, who said he thought that if he could just get everyone in the same room together, they could work together to better protect public health. So the structure of health and all policies programs varies greatly across states. There are all sorts of structures. Some are policies, some are programs. In this case, Tennessee's program is voluntary. And nevertheless, even without any kind of a policy mandate, it's considered the strongest in the country. So a lot of different structures can actually work for this. And so it's really been successful, and they did a deep analysis of it a few years ago and identified some of the successes. So it's really increased efficiency, innovation, increased health benefits. It's reduced duplication. So just one example is that there was one agency that was developing a set of livability indicators, And then there was a regional campus of a state university that was also doing exactly the same thing. And these two state bodies were unaware that they were doing exactly the same thing until they came together as part of one of these lunch meetings. And of course, duplication is, inefficient, and it ends up costing, the time of the staff that are involved. So this is just an example of reducing duplication, increasing efficiency. Agencies are working together on grant applications together because they see how they're able to pool resources. They see the potential for that. Next slide, please. And so these are the 24 Tennessee state agencies and commissions that are part of this livability collaborative. And it is, as you can see, just very, very widespread. And so very, very comprehensive in terms of the agencies involved and the issues they address, and every single one of these has the ability to help to improve public health. Next slide, please. Yeah, and so another best practice is Colorado. Colorado is just a little bit different. Well, it's different from Tennessee in a few ways. One is that it actually started as the Department of Public Health and Environment. So from the very beginning, we did not see a siloing of environmental protection and public health protection. They were actually organized and put together from the very start. And my understanding is that the reason for that is that there was so much mining in Colorado, and state officials understood that mining affected both the physical environment, and also, of course, public health. And so these were, twinned at the beginning, and so it's a little bit different. But also, Tennessee's effort, again, was top down. Colorado's is bottom up. So it was initiated by the Office of Health Equity within the state Department of Public Health and Environment. And they started to take initiative and develop some programs, and it moved up and ended up getting the support of the people, the decision makers at the top level. So successes include data sharing between the public health department and healthcare systems, a dashboard to share information among different departments. And just a few success stories include a multi-sector plan for aging. So the plan to help with ensure healthier aging in the state pulled together housing, transportation, healthcare, going way beyond just public health programs. And then a data and community dashboard that enables sharing of data platforms and using community dashboards to track health indicators across sectors. And I think this is really critical. I mean, if you think about if a hospital that is seeing asthma cases is not sharing data with the health department that is surveilling asthma, and departments that have the ability to reduce asthma triggers, then you're missing out on a real potential efficiency. And so I think these data sharing platforms are really critical. Next slide, please. And so lessons learned for other states. Let's see. Again, as I mentioned, these efforts can take many different forms. They can use a variety of terms. Tennessee doesn't call it health in all policies. It doesn't have a law requiring this. Nevertheless, it's considered the leader in this area. It's important to educate agency staff about the distinction between healthcare provision and population health or public health. So this is often misunderstood. A number of people I interviewed told me you really need to include people who are systems and policy thinkers, who think that way, who aren't just interested in sitting at their own desk in their own agency and not taking a more kind of systemic view of things. Demonstrating to staff that it's worthwhile and not extra work, being creative where there's a lack of dedicated funding or a dedicated person for this effort. And again, critically sharing data. Next slide, please. Okay, so I think we were talking about taking a little break here for discussion.
Thanks, Susan. Thanks for those discussions. We do have a little bit of time here for a quick discussion. I wanted to raise up one question that was recently asked in the Q&A for you, and potentially Jill as well. The question has to do with the role of health impact assessments, and whether or not you would characterize the California approach as utilizing a health impact assessment.
Oh. Wow, that's an interesting question. I'm not sure I actually have a good answer for that. I would have to look and see whether they use that term. So a health impact assessment is trying to understand what the impacts are on public health of something happening, whether it's a policy, a program, etc. And it seems like that would dovetail beautifully with the California program. So if they're able to identify a community that is especially impacted by pollution, could a health impact assessment then help to identify how, what happens there? So, or what should not happen there, and how can policies and programs protect that community? It makes sense. It makes a lot of sense, and I think it's possible, but I'm afraid that I'd have to go back and look at the intricacies of the law to be able to give a really clear answer. But it's a great question.
Thanks, Susan. We have one more that just recently came in from the audience, and that is, what recommendations would you provide for state legislators?
Oh, for state legislators. Well, state legislators who are interested in taking action to protect environmental health in their state. One thing is education. So, do they understand how the environment impacts human health? Do they understand environmental health? And that's the first step. Another step is educating their constituents. So if the state legislator wants to do something to reduce pollution, they're going to want to gin up support for that. And so educating their constituents could help with that. What would the benefits of this action be? How could it improve health? How could it improve your child's asthma? How could it save money for the state, for the healthcare system? I would also say state legislators can look to many different resources in developing policies. They can look to these best practice states that I'm discussing, as well as other best practice states. They can look to organizations that are specifically pulling this state information together. So that would be, so for example, the Association of State and Territorial Health Officials is pulling together health and all policies information. How can this be done at the state level? And so I would look to them. A lot of other organizations, so let's see, Environmental Council of the States. I can't really think of the whole list of organizations, but there are a lot of resources out there. Yeah, so I think education, resources, looking at model policies. A lot of these organizations offer model policies. And so there's a lot of resources out there for state legislators who are interested in this.
All right, thanks, Susan. We have about a half an hour left. And so there are a few other questions, but I'm gonna say let's continue with your presentation and we can get to some of those at the end of our time during the second Q&A. Okay,
Great.
thanks.
Okay, so we'll move on to regional efforts to address climate change. And to me, this is one of the most interesting state kind of best practices because I think this is totally on the up. So regional efforts are growing every week. And so I think this is really, really timely. So the Regional Greenhouse Gas Initiative, like some of the other model state policies I mentioned, goes back quite a ways. So it was established in, I think it was the early 90s or mid 90s. So there is a lot of information about this effort, and it's a big, big success. And so this is a cap and trade program. I think you've all heard of cap and trade. To reduce industrial carbon dioxide emissions. And so an overall cap is set. Each participant can buy and sell within their allowance. And the idea is that this cap and trade system makes dirtier energy more expensive and supports development of clean energy. So currently, I think 11 states are members. You can see the map here on the left. I think Virginia joined and then withdrew. I think Pennsylvania withdrew recently, but essentially 11 or 12. And so because this effort is market-based, it's seen as more versatile than the sort of traditional command and control laws. And so each state can make its own choice whether to join or not, and then enacts its own law. Next slide, please. So again, this has been very successful. So RGGI, as it's known, has cut CO2 emissions 50% faster than the rest of the country. As of January 2024, the RGGI states had raised $7 billion through these auctions. The majority of that money, so it was spent within the states by the states, and the majority of those funds have been invested in energy efficiency. Looking at just 2022, so just looking at one recent year, investments from RGGI proceeds were projected to save a total of $1.5 billion on energy bills for households and businesses. There are huge health benefits in the reduction of fine particulate matter and other contaminants, and that has been quantified by both apt associates and a team of professors at the Harvard School of Public Health. Many reduced or averted asthma cases, bronchitis, heart disease, preterm birth, low birth weight, etc. And let's see, next slide, please. Yeah, and so how do they collaborate? So there was a model rule that was developed at the beginning by the whole group of states that was working together. And so it provides a framework. So this is a professionally managed effort. There's a professional staff that manages Reggie Incorporated, which is a nonprofit organization. They manage the auctions, all the financial aspects, the communications. And then decision making happens from a board of directors made up of the energy and environmental heads of each member state. And so they make decisions. Those decisions include when it's time to lower the emissions cap. Next slide, please. So the keys to success, and this is really important. A number of these states already had working relationships from previous efforts. So they already knew each other and had a level of trust. So this is important. So the takeaway from this is, get to know your neighbors. Within most of the Reggie states, there were already close working relationships of state environmental staff and energy staff. Again, health and all policies, we already had environmental and energy staff working together. There's political and technical flexibility to meet the needs of the states. So each state is able to make a number of its own decisions, such as whether to join, and then adopting its model rule, and then how to spend the funds from the CO2 reductions, how to spend those funds in their own states. And with all of these states working together, they were able to draw on a much broader array of resources than any of them could have on their own. And so I think this is really key. So given that right now, there's been a pullback in federal funding, a lot of states are pretty strapped for funds, and you can really increase resources by working with other states and pooling efforts, pooling resources. So I think this is just a really timely lesson. And I want to quote somebody from my book because I think this is also really, really important. Ben Grumbles, a former Maryland Environment Secretary who was closely involved in the development of Reggie, agrees that flexibility and autonomy are keys to Reggie's success, especially when states span Democratic and Republican leadership. He said, these ingredients helped keep Reggie alive during political transitions because each state develops its own plan for reducing carbon dioxide and investing revenue gained from the program. While program reviews have at times revealed a risk of division along party lines, the states were all committed to finding common ground. Given all the debate over climate change, bipartisan environmental leadership is more important than ever before. And so this is again a quote in my book from Ben Grumbles, who was at the time a Maryland Environment Secretary, about some of these keys to success that I think are really timely. And these regional efforts are growing. And so others include the Western Climate Initiative. And then some of the Reggie states are also working together now with Georgetown University to develop something similar to Reggie focused on transportation emissions called the Transportation and Climate Initiative. And there are additional ones as well. But I think, this regional structure is again on the increase and just really interesting and potentially offers many benefits. Okay, next slide, please. So another regional effort is called the Southeast Regional Partnership for Planning and Sustainability. And so this partnership was started by Bill Ross. He was the Environment Secretary for the state of North Carolina. And he started it because of something called the Woodpecker Wars. Um, the woodpecker was protected under the Endangered Species Act. At Fort Bragg, their population was declining due to the loss of the tree in which they nest, the longleaf pine. The U.S. Fish and Wildlife Service required the Army to protect the bird, which interfered with its operations, with the Army's operations. Meanwhile, people were moving to the Southeast. Homeowners and developers were cutting down longleaf pines. And the Navy, on top of all of these things that were happening, the Navy was considering siting a landing field near a wildlife refuge for migratory birds, which could have risked their safety. So you have all these intersecting challenges, what to do. So Bill Ross went to the Department of Defense and said, we should have a forum for working out all these different issues. And they got together and developed this partnership. And Bill Ross, again, one of the more interesting people and really impressive people that I interviewed for the book, calls this an unconventional partnership because it's Department of Defense, both federal and state military, a whole range of state agencies across agriculture, environment, public health, natural resources. And partners achieve their goals by working together. Next slide, please. And Bill based the structure on the business book called Getting to Yes. And so again, unconventional partners, but he developed a structure where people could work together across whatever differences, partisan or whatever other differences they might have, to try to achieve a greater good. And this was successful. So the woodpeckers were protected. The military was able to not have its operations interfered with. The number of partners has continued to grow, and the number of issues that they work on has also continued to grow with a major focus on climate change. So many of these states are coastal, so there's a focus on coastal resilience, protecting salt marshes, prescribed fire, and this has continued to be successful. Bill Ross said about this partnership, you sometimes hear it described as the best example of a landscape scale conservation success story in the world. And so protecting conservation, protecting public health, many, many positive outcomes and successes. Next slide, please. And so I just wanted to give a sense for the structure of SURPASS. And Bill said it's not SURPASS, it's SURPASS. And so I want to make sure I pronounce it correctly. So this is the structure. So we have three sorts of levels of groups that meet together. Development of a GIS tool that integrates the data from all of these different agencies at different levels of government is really critical. Prioritizing in-person meetings and networking to help build trust. So this is how this very, very broad collaboration has worked. And Bill made another interesting point, which is that very broad, bipartisan, unconventional partnerships also increase political power. And so they're able to do more with that increased political power. Again, in terms of the growth of regional partnerships like this specific effort, Surpass, was copied on the West Coast and gave rise to the Western Regional Partnership, which is a similar type of collaboration that includes federal, tribal, and state officials in Arizona, California, Colorado, Nevada, New Mexico, and Utah. So again, we have this best practice example. Other states across the country looked at it and they said, hey, this could work for us too. And took some of the lessons learned from Surpass and developed their own structure. Um, and I see this happening more and more. Next slide, please. Yeah, so benefits of a regional approach, and I think I've already mentioned some of these, so I don't have to talk about all of them. Pollution doesn't stop at the state line. One of the big benefits of RGGI is that it has enough members and covers enough space geographically that there's less of a likelihood of one of the RGGI states purchasing power from a non-RGGI state that perhaps is producing its energy through coal. So the more members, the less leakage. And so you have power in numbers. And I think, you have, when you share regional characteristics, you're already having a head start. So those northeastern and mid-Atlantic states that developed RGGI already had a working relationship, and they share a number of regional characteristics, and same with Surpass in the Southeast. Next, please. So advocating, I'm going to go through this really quickly because I see we're at 13 minutes after. So I'm just going to spend a couple of minutes on this. Next slide, please. So some of the solutions that I describe in my book to help expand environmental health policies. Environmental health education is really at the bottom of developing policies. People need to understand how the environment affects health and how critical that is. All of my best practice state policies carried out expansive economic analyses showing an absolutely positive return on investment. And that is always going to be a question. What will this cost? Several of my best practice states are based on very close government, university, industry partnerships. And those are fantastic. Every state has a university extension service that can help fulfill the university role. Taking local action, local departments can do very, very, very innovative things. So local health departments can do something very innovative. I describe a few examples in my book where then a terrific local policy, there was a push to move it up to a higher level of government and then be adopted, for example, by the county or by the state. Next, please. And state preemption of local policy making, that's been an issue for years. And of course, now we're also looking at federal preemption of state policy making. Expanding policy surveillance and legal epidemiology. And this work is being done in a number of universities and other organizations around the country, like Temple University's Center for Public Health Law Research, to better understand what policies are actually being enacted and implemented across the country, and to better understand how those policies actually influence health outcomes. Next, please. And just really quickly, the last few chapters of my book talk about advocacy steps and use an example of the effort in New York City to ban pesticides in parks and on playgrounds. And so that is my advocacy case study in my book. It was successful. And even though I think it took 7 or 8 years, it was successful not only in terms of enactment, but also in terms of implementation, which is just as important as enactment, if not more so. Ben Kallos, the New York City councilor, was the champion. So identify a champion. He was the champion, and this is him. And this group kept developing into a bigger and bigger coalition. It's amazing how big the coalition became. The Black Institute, dog owners, and it's fascinating. So it's a fascinating case study. And I'm going to stop right there.
Thank you, Susan. So we had a variety of questions that have come in during your presentation. We also had a number of questions that came in during the registration process. I'm going to start with some of the questions that have come in during the presentation, and then we can move to the others if we have time. One person asked for a little bit more about the discussion of purple monitors in Louisiana. They said Louisiana is well known for its community leadership regarding bucket brigades. Were those also restricted?
I would have to ask the person from Louisiana, what are bucket brigades?
Okay. Maybe they can type that in the Q&A and we can move on to another question and come back to that briefly. This question is about issues related to interstate compacts. It seems that interstate compacts can be a major barrier to regional collaborations, but it doesn't seem to be an issue for RGGI. How can we structure our approach to avoid pitfalls related to interstate compacts?
Yeah, I guess Jill or Betsy or someone else, what would be an example of an interstate compact that might raise these concerns?
I don't have a great answer for you, Susan, to
Okay.
be honest,
Um,
about what the pitfalls would be.
Yeah, I don't think I'm able to answer this question offhand. I'm sorry.
Yeah, that may be something we can consider. I mean, we've certainly,
Uh-huh.
Betsy, you've done work on the Great Lakes Water Interstate Compact. So it might be that certainly one would want to be aware of any
Uh-huh. Uh-huh.
overlapping interstate compacts.
Uh-huh. So the idea would be that you don't have one interfering with another, so that you don't have two types of compacts that are potentially working towards different goals or involve different steps. I think is that does that sound like what the issue is? I guess like you're saying, Jill, it makes sense to understand exactly what's in place and I guess work from there. But it sounds like an important question that I will look into more.
Okay, thank you. So we do have an answer about what bucket brigades are.
Oh,
The attendee said that bucket brigades in Louisiana use simple buckets to monitor community air impacts. They are called this because they literally look like buckets. They are
ah,
simple and cheap to use.
okay. What I found was that very recently they specifically prohibited purple air monitors, and I don't know all the details, but it seemed to be an example of a little bit of a push and pull between, states and localities are doing. And I don't know that it was a question of state preemption. It might have been a question of state preemption or some other issue about who is collecting and controlling this data. But I can't really speak to the bucket brigades.
Okay, thank you. We did have some questions come in earlier about the relationship between state and tribal governments as they relate to environmental health. Specifically, if there are examples about how states have considered tribal health policies or interests, or whether you have any insight on what some tribal perspectives on this issue might be.
So I'm going to pass that to Jill.
Okay, sorry, trying to do too many things at once. I mean, I think there's things. I mean, states can first be aware that tribes in particular have been working on addressing climate change for years. Um, there was a collaboration probably 10 years ago between the CDC and the National Indian Health Board called the Climate Ready Tribes Initiative. And under that, a lot of great things were developed. For example, the Swinomish tribe developed an indigenized version of the BRACE framework popularly used by CDC and incorporated more essentially indigenous values into that. So there's a rich history here. There's tribes that are identifying indigenous climate indicators from sort of an epidemiological perspective. And then recently, there's been this development of the concept of traditional ecological knowledge. And so states, California has done a lot of work on this with a number of tribes in terms of, wildfire mitigation, prescribed burns, data collection, and the like. Louisiana, their Sea Grant College has worked with the Pointe-à-Chien tribe, essentially to address sea level rise, combining tribal ecological knowledge approaches with modern GIS approaches. And, the network has had some legal TA requests about this. One thing for states and tribes together to think about is to what extent tribes would want any of this tribal ecological knowledge, would want the confidentiality of that data protected. So that's another thing for states to consider.
All right, thank you, Jill. We have some, I'm going to turn to, there were a couple of questions that I may be able to answer, but I'll give you the option to answer if you are. There was a question that asked, what do you mean by legal epidemiology?
I just myself watched several webinars put on by Temple University's, I think it was their Center for Public Health Law Research about legal epidemiology. So I'm still learning myself. I think it's something that's really interesting. So it's looking at, so if you think about a map, if you think about a GIS map, and you think about public health policies and you put them on the map, and then you look at health outcomes and you put them on the map, how are public health policies affecting public health outcomes? And it's very complex work, just as it sounds like. But I think there are a lot of other kinds of data that are that are pretty widely available, for example, in public health departments, whereas public health policies are not really systematically tracked or connected with or analyzed to understand their health outcomes. So I'm explaining it as best as I can, given that I'm new to it. But I think this is another up and coming area of work. So policy surveillance, what are the policies, the public health policies around the country at different levels of government? And then legal epidemiology, like public health, like epidemiology and public health departments, but connecting the law and the public health pieces. And I'm sorry that I'm not explaining this better, but I would send people who are interested to Temple University's Center for Public Health Law Research. Also, I don't know if it's still there, but the CDC has had a website about legal epidemiology. And so there are resources that people can look at. And I hope that I expect, but mostly I hope that this area of work will increase. I think it's important. I think it can help us spend public health dollars more wisely, and also as also increase trust in public health and what its outcomes can be to improve health.
All right, thank you. We have about 2 minutes left, and I know someone has asked for the name of your book again, which is on a slide that we can show shortly. But we did have a question that maybe I can start an answer to, and Susan and Jill, you can chime in to expand on that. There was a question about how we can keep large companies accountable for contaminating the environment. And there is one approach that is being sort of lifted up this week during a campaign by the Make Polluters Pay program, our organization. It's climate superfund laws. Also, you may have heard them, Make Polluters Pay laws. Essentially, these are laws that attempt to shift the burden of cost recovery and resilience efforts and cleanup efforts after climate disasters occur to the companies that are most responsible for that damage, specifically the oil and gas companies. And there are 2 states that have adopted these laws, Vermont and New York, and there are several other states that are contemplating that. They essentially work like a decades-old law called the Superfund law, where the state and federal government don't have to clean up the damage that was caused by specific polluting companies. And the idea is to shift the financial responsibility back to the polluters. I think there's a variety of ways these will operate, and currently there are none that are actually happening because they've been challenged in the court system, and they do require quite a bit of administrative preparation before those programs can get up and running. But both Vermont and New York have adopted them, and other states are looking at them. And then I will ask just one more question. Oh, it's 1:30, so we might be done. I feel like so much great information has been provided by our presenters, and so many great questions as well. So thank you everyone for participating. And here again on the screen is the name of Susan's book, A Healthy Union: How States Can Lead on Environmental Health.